Millions of people living with type 2 diabetes in England, Wales and Northern Ireland could see the biggest shake-up of care in a decade, with new guidelines for more personalised treatment.
Yeah, a test that lets people check their risk in minutes using a finger prick and a smartphone is being developed to help make detection quicker. Here's our reporter, Nikki Fox.
We start by pricking your finger with a lancet. So we wait for a small blood droplet to form and add the blood to the vial.
A test that could soon be sent through the post to diagnose the missing million, those who have diabetes but don't actually know it.
We would then leave that for 2 minutes.
The app for a smartphone or tablet has a timer and guides you through the test. You take a picture of the results strip.
And then press process.
And the techie bit is the app reads it and does the rest, sending the results electronically to your GP.
As you can see, your HbA1c result is in the green zone, and that means it's healthy.
So that's kind of what I was expecting, which is good news. But if it was in the higher range, would that really change anything for me, do you think?
Yes, it would. It's really important that people know their numbers, because by knowing your numbers, you know whether you are at risk or not, and you can take preventative steps.
I spoke to the NHS in the North East, who are trialling it first. You can already get the test at a GP surgery. So why is a smartphone best?
People can get the results within 5 to 10 minutes. And you can actually talk to them about what the results show, and perhaps even, if it's possible, give people treatment as well. So that's hugely time efficient and ultimately will save money.
Type 2 diabetes is more likely as we get older, and some ethnic backgrounds carry a higher risk. But it can also be caused by a lack of exercise and poor diet. When this happens, sugar builds up in the blood. Short-term symptoms include tiredness, extreme thirst and blurred vision. Long-term, heart disease, kidney failure and even vision loss. The smartphone test hopes to diagnose more people like Patrick from Luton. He didn't know he was borderline diabetic until he was tested by a GP. He used the knowledge to turn his health around. An NHS programme helped lower his blood sugar.
I just stuck to the meal plans that they gave me. It was a 3-month challenge. I had a choice of soups, shakes, and I continued to do the exercise, and that probably helped drop the weight even quicker.
Did it work then?
I'd like to think so. People have given me positive comments. I lost over 4.5 stone, and I've managed to keep it almost all off. Yes, diabetes is in remission. I'm still getting checked all the time to make sure that it continues that way. But now I'm in that lifestyle, I know I'll stick with it.
In 10 years, the NHS is predicted to spend 17% of his budget on diabetes-related conditions. It hopes by giving patients the technology and knowledge to change things, many conditions could be prevented.